Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Quinapril. Its brand name is Accupril. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. In this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe Quinapril to a patient, followed by contraindications or reasons we would not be able to prescribe this medication. We'll then touch on examples of dosing and then follow it up with side effects with percentages. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Quinapril hydrochloride inhibits angiotensin converting enzyme or ACE. It is believed to lower blood pressure by suppression of the renin-angiotensin-aldosterone system. Inhibition of ACE blocks the conversion of angiotensin 1 to angiotensin 2. And this causes a decreased vasopressor activity and decreased aldosterone secretion. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in hypertension or high blood pressure, and patients with heart failure may also use this medication. With respect to contraindications or reasons we would not be able to prescribe Quinapril, we wouldn't give this medication to a patient who had a hypersensitivity to Quinapril, any other component of the formulation, or to other ACE inhibitors. This medication should not be used with aliskiren in diabetic patients or with neprilysin inhibitors such as Accupril. History of angioedema related to therapy with an ACE inhibitor would also make this a contraindication for a patient. Now for some examples of dosing. So in the treatment of hypertension or high blood pressure, if a patient was using this medication and they're not using a diuretic, the initial dose would be 10 to 20 milligrams orally once daily. They would adjust the dose about every 2 weeks as needed, and the maintenance dose would be up to 20 to 80 milligrams once daily or in equally divided doses. In the treatment of heart failure, the initial dose would be 5 milligrams orally twice daily. They would adjust the dose weekly, and the maintenance dose in this case would be 20 to 40 milligrams daily, given in 2 equally divided doses. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Quinapril, so I'll go over some of those here now. Some patients may experience hyperkalemia or high potassium levels. 2 to 4% may experience a cough, while a headache may happen in 2 to 7% of patients. Fatigue may happen about 2.5% of the time, as well as chest pain, again 2.5%. 4 to 7.5% of patients may experience dizziness. Now, a few serious side effects would be intestinal angioedema, hypotension or low blood pressure. This may happen 3% of the time, or a syncope or fainting. This may happen up to 1% of the time. Alright everybody, that's all we're going to talk about today with Quinapril or Accupril. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.